Ready?
Just take another 50.
We ಹೇಳ್ತೀಯಾ?
Yes, 22 values.
ಇದು ತೆಗಿಲ್ಲ. ಅವ್ರು ಹೇಳ್ತಾರ ಯಾವಾಗ ಸಾಲ್ವ್ ಮಾಡೋದು?
Yes, sir. Yes, you can go.
Good afternoon, friends. I think you're all safe and sound at home and keeping yourself safe from this problems what is going on. Uh, Everything has to come to an end. We all know that at some point of time we are going to come out of this phase, and with God's grace, I'm sure that we are going to go back to what we started. But we have to understand one thing very clearly: the old way is just a memory. New is the reality. And how do you combat this reality is what we're going to discuss today in the next few minutes. I used the title of 3E. The alphabet E is very important in English language, according to me, because it's one of the most powerful and most positive alphabet. The words which starts with letter E starts with always is positive. The enlightenment, enrichment, education, evolve, educate, everything comes under the letter E. So I decided that as we move on in this post COVID era, how do we educate, evaluate, and most important, how do we empathize with people who are not as fortunate as us? We, if you really look back at this whole the virus, we are quite fortunate. We're fortunate that it's affected like all the other countries in the world, but there are different reasons why we have been blessed in many ways. Maybe our immunity, the food we take in, our vaccination. I mean, we really don't know. As a scientist, it's very difficult for me or my group or anyone to find out what is actually going to protect you and what is not going to protect you. Every single day, we look at a lot of research being published on this, and we get confused because one research says that you take certain drug that does better, the other research says that that doesn't have any role. So it becomes very difficult for a doctor to treat. But the most important thing about this virus, or today this is COVID or corona, tomorrow there could be something else. We all have to be ready to face epidemic, pandemic in the future. This is not going to be the last one. This is going to be probably the curtain raiser. As doctors, we realize our environment is changing. The the way we do way we work in our environment is different. So we are going to see a lot of them. So this is just a curtain raiser for what may come in the next 30, 40 years. It's affected us severely because India is a if you look at the population of India, the major chunk of population is young people. The compared to the European and the other population where the majority are the older groups. So if you look at major catastrophes in the past, the elderly generation have actually faced it. World wars, uh, plague in the past, many other difficulties. We are all consider ourselves as the millennial generation, the generation which is born after 1980s. So difficulties for us has been less. We all been blessed. I can speak for myself and a lot of people of my age group or the younger age group. So we have not seen that difficulties what our previous generation has seen. So staying at home, being at lockdown, or how to come back, a lot of us have never planned it in our life, and I don't think we have factored it. So I am very optimistic that I think we'll overcome this, whatever the phase we are in, we'll go through this, and whatever we call it immunity or like I said, the whole protection, the kavach we have, the armor we have will protect us against the future or the present virus. This is what I'm very positive about. So let me start off with when we open up, it's not that we have finished with this virus. To be very frank, the virus is all about, lockdown is all about for this virus now, is to save time or buy time. When you're buying time, we machineries are trying to get ready for the next phase. If the lockdown opens, to be very frank, it's not the end of the virus. It's actually the beginning of what we need to do and how we need to take care of you and your family. This time we got during the lockdown, it reduced the spread to a certain extent and made us to get prepared. So we're just in the phase of being prepared. We are not in the phase of being conquered. So the conquering phase, this has to be very clearly understood. There's a phase of preparation and something called conquering, and we have not conquered that yet. So when you call education, it's like the story of a fisherman when they don't go to sea to fish. What do? They take care of the nets. They prepare for the rough seas and the rough work ahead. So when we are in a lockdown now, we have to have certain mindset of how do we prepare. We have to get that mindset of a fisherman who is sitting and taking care of the nets. So let's start off with our first education. With my first E is the children. See, we every day we praise the healthcare workers, the policemen, the people, the staff who take care of you. But let us also spend a minute thanking our children to have so much of patience, so much of bundle of energy they have. They're staying at home, not troubling you too much, I hope, and they are still taking part in this biggest lockdown the mankind has ever seen. So children needs a one round of applause for being with us. When we finish this lockdown, most children have no idea what is happening. They just blame the parents that they've locked us themselves up. They have no idea what quarantine is. They have no idea about what isolation is. So when you finish this, they suddenly get into the speed that everything is over and we go back to normal life. And that is going to be the disaster. According to all the epidemiologists and scientists, we believe that this is going to take at least 6 to 8 months. Some countries have said that they're looking at next 1 year. So at least in our state, for the next 6 months, as parents, be very aware of what your child is doing outside. Please do not allow the child to play unsupervised because children don't know. They just touch something, they may just not wash their hands, they may not maintain social distancing. They're not aware of what is happening. If the child is coughing and this child has no idea what it is, they'll still hug and play. And that is the major challenge for us. How do we take care of the most vulnerable part during this phase? I would say taking care of children and taking care of elderly people are very vulnerable because they have comorbidities, they have diseases. If you take care of these two people, we have nearly conquered a virus. Because healthy people, we don't need anything. The God has given immunity to us to do. When you are with these two people, the elderly and the children, be always mindful. The word mindful means your mind is at them. Your not mind is filled with things which is other than them. Be mindful of what they are doing. An elderly person who walks on his own needs support. He will hold every single pillar, he holds every single thing which could be potential cause of spread. The children, so be very careful. What do you do with them? How do you teach them? So basically, in this time period, in this lockdown time, please make an effort to teach them what do you mean by, how many of us have actually spent time with the child explaining to them what is social distancing. I learned social distancing word during COVID, so I don't expect the child to know what is the meaning of a good hand wash. What do you do when you come back from play? Same to elders when they go out. What do you do when you come in? So there are enough videos, and we'll also post some of our videos in our website about what do you need to take care when you come in and go out. It's a very important phase is to spend time. So educate your children and elderly on all these things which you think we know, but we are not actually telling our children. So I think they are the most vulnerable part of this. Expect schools. I would have a lot of good friends who run schools. If there are teachers watching, in this lockdown time, please have a curriculum for the child about what is lockdown, what is the future, how do you take care of your hygiene, and what do you do, what is meant by social distancing. This is the most important now rather than conducting exams. See, exams, if you're alive, you can have 100 exams. Few months is not going to make a difference to your life. But a few bad steps will definitely going to create a problem. I think this is what I feel the schools have to help us in this, in the healthcare. So as the doctors in front line and all the people who are working for you, you also have a responsibility as teachers. The major responsibility is how do you teach? And as parents, we are the first line of teaching. And how do you teach your children? And that is the most important thing. Also, make sure that your drivers, your maid workers understand all this and be consciously repeating that this is the most important thing. All these people are going to be the silent heroes. So each one teach one. That's how you need to do. You also educate people about building your immunity. How do you build your immunity? The best way to build your immunity is be active. Even if you're at home. See, if you've never exercised in your life, I think this is the time you do it. A good exercise keeps you good, very fit. You need to be fit to fight this virus or some other virus. This virus may be a, I'm not just talking about corona. There were other cousins, brothers, aunts of this virus which can still come in and create problems. So let's be prepared for them. Take care of your body. The only thing which can help you today is not the doctor. It's not your wealth. It's not your knowledge. It's not the efforts put by the government. It's how well you love your body. If you don't love your body, then this is never going to help you in your fight. And the good body is what is going to fight. All the patients who are shown going to ventilatory thing, or patients who are in difficulties due to corona all over the world are the ones maybe the results is probably will come. I think most of them are elderly who are comorbidities or people who may not be fit. The immune system is probably the best thing. So how do you take care of your immune system? Be active both mentally and physically. If you can't go out for walk, do some exercise at home. There are a lot of online yoga thing. Practice yoga. Expose yourself to sunlight. Vitamin D is one of the very strong immune boosters in your body. A lot of us suffer from vitamin D in spite of being in India. The reason is we are not exposing ourselves to sunlight because we don't like sunlight. We feel that we get expose yourself to sunlight in whichever. You don't need to go out to do it in your balcony or windows. The best time is between 7 to 9 a.m. in the morning. That sunlight is an immune booster. You need that now. Have a lot of Indian food contains tremendous amount of immune boosters. Our forefathers, ancestors have told us many times. I think over time, because of lot of cultural diversities, we probably have left a lot of those food. For example, vitamin C in your food is probably one of the biggest immune boosters. Uh, Ashwagandha has been known, even in Chinese medicine, the ashwagandha is known to contain tremendous amount of antiviral properties. One of the strongest antiviral properties has been found in curcumin, the turmeric what we use. People have honey and turmeric in the morning. The curcumin is one of the potent ones. So it's all there. We just have to rework it and get us back into our cooking table and make food which has the potential to protect it. See, at this point of time, we are much better than many places. Maybe it's a food we eat, we don't know. It's very difficult as a scientist to prove it. But there's nothing which can harm you. Even if it doesn't protect you directly against virus, it protects you against something. So if there is proof, please take it. So sunlight, physical exercises, at least 2 hours a day, expose you to sunlight at least 20-30 minutes a day, get your vitamin D back, have a lot of vitamin C, turmeric, ashwagandha products which builds your immunity, and anything which stresses you reduces your immunity. Eventually, all of us are going to get one form of this coronavirus infection. Many of us might have already got it and we might have not known about it, or we will get it and we'll just like flu. Eventually, we will get it, or we will have to get a vaccine. So you get it or the vaccine. There's no way out. So when you protect yourself in the future by being healthy and loving your body and taking care of your food and changing the way you are, then it will just like a flu. Like you would probably never even bother. Maybe it's just a little bit running nose, sore throat, and you're finished. So that's given you the immunity. Once you get it, then you have that immunity, and eventually, our prayers are that will build the herd immunity, which is what protects you against this kind of virus. But I'm saying this is what is very important. And we all are social animals. We like to mingle with people. One of the things we have to do today is try to avoid as much of possible mega functions, mega marriages, mega things. That's what I said. What was old is over. You have to just take it like a golden moment, but it's finished. What is today is how do you socially distance from things which is not necessary. So if you feel that somebody has called you for a big function in May, just because the lockdown is open and you just want to go there, remember one thing: you're not only trying to create problems for yourself. You may be strong, but there are so many people at home. Like I told you, the elderly and kids are vulnerable, and you're actually bringing those virus to them. You may not suffer, but they will. But it's more painful when you know that it was your mistake. So be very careful about attending these kind of events. And if possible, if you are conducting one, few months is not going to make a difference. Schools should try to push as much as possible. It's lockdown. Just because it's lockdown open, just don't go into this spree of classes. Everything can wait. If you have life, you can wait. Nothing is going to happen in few months. Encourage personal hygiene. Just don't stop it just because the lockdown is over. Social distancing, maintain it as much as long as possible. Maintain it for the entire life. You know, one of the strength of Japanese culture is they maintain social hygiene, social distancing. They don't, when you see them moving, it's always some gap between them. That these are the things which protects these countries. And the way you wear a dress has to be, for example, half shirts is what is recommended. No ties, long hairs. People have to be very careful. And if you were wearing jewelries or watches, these are the things which can bring in virus to your house back. So if you are wearing a tie or a full shirt, you put your hand, you can't clean it. But when you're using your hand, there's always a sanitizer where you can clean yourself. So these are all small important things. If you have a dog at home, you take them for a walk. Be very careful where the dog rubs the surface. We don't know. People may tomorrow, people may cough. They may just cough on the road, and this virus are known to survive on surfaces for long. So make sure that you don't actually very mindful what your dog is doing. And every time the dog will come back from outside, make sure that you wash the paws with soap water so that it's clean. So every single thing which can bring the virus inside, you have to take care of it. A doctor in AIMS said, it's a very nice, the director of AIMS, who's a pulmonologist, who said that the virus has a lot of ego. Unless you actually welcome him, open the doors and welcome, the virus doesn't come into your house. That means everything which can actually bring the virus, full arm shirt, and you are putting your arm on a surface which has virus, and you come home and keep the virus, then you are actually breathing. So be very careful about every single things you do. So because these small things will have a huge impact. The second part of my E is empathize with people who are less fortunate than you. Maid, your drivers, people who are serving vegetables. I think all of us need our empathy. Let's empathize with them. They are also, because we may be fortunate, but there are a lot of them not so fortunate. Help somebody, because India needs help. It's not just paying for a fund. We need to help people. It's a tough phase. If your charity starts at home, if your maid's children needs education, help them. People who can't, you may be stretching yourself. It's a very difficult time of your life. But they say that at this point of time, try not to build a bigger wall around yourself and be safe. Try to make a bigger table. When I say a table, accommodate more people, feed them. And when you build a bigger table, I think it's a matter. This is a matter of time that we overcome it, and you'll remember this for the rest of your life. So build a bigger table, not bigger walls. And the third part of my thing is about evolve. Once we finish this, I'm saying there's nothing called finish. It just, the whole lockdown is buying time. We just have to keep our society clean. We have understood we had a very tough education. COVID, Corona, locking. I think this has been a great teacher. Tough teacher. We may call it unnecessary, but it has been a teacher. You have to accept it. It's teaching us that you need to keep clean. We don't maintain social distancing. When you queue up, people are pushing each other, everybody's touching each other, and that concept has to change. And this is not that it's going to go for a few months. It may go for a year, it may go for many years. We don't know at this point of time. If vaccine comes, it's not easy. developing vaccines very quickly. We don't know what is the efficacy. That means a lot of vaccines, they, it may just be efficacious for some people, but some other people may not be beneficial to it. Even it comes, it may go to the vulnerable population. So let's keep our needs less. Let's not just go back after this phase to the exactly same thing what we started on May 22nd or 23rd when the lockdown came. March. That phase is over. You had to look at a new baseline, attending the same kind of, like I mentioned, attending the same mega marriages, mega functions. All this will become part of history. If we're still doing it, that means we have not learned anything from this. That means we need one more tougher teacher than Corona to come to your doorstep and explain. And I don't think we need that. We can't take it one. We can't take it again. So let us be very aware. At the end of my talk, what I'm trying to say is be mindful. When you say mindful, when you're sitting, walking, eating, you're keeping your, when you even given a shake hand or turn to a namaskar, namaste, be very, very clear about how your body is reacting to the environment. And once you do that, you automatically for life become socially distanced from things which are harmful for you. If you're able to socially distance from harmful things or something which you have no control on, then I think you have reached the peak. You don't need to wear a mask, which is for the medical professional. They are the ones who are going to treat the people on in the hospital. You can wear a cloth mask, you clean it every day, that should be good enough. And enough videos on how to make it is there. So I end my talk with 3 E's: educate, educate your children, educate all the people who need that part of education, empathize with everybody, and build larger tables which can accommodate more people, not walls, and evolve. At the end of it, you all have to come out the good students because you had a very tough mentor, a mentor who closed down everything for you to understand. So this is what we need to learn and read and teach. I wish you all very prosperous year 2020. I'm sure we all will come out of it. I'm sure we'll be very positive, and I'm very sure this is a temporary phase which will also move on. Thank you. I have a few questions, which is about travel and visiting places in the future, staying in hotels, flying outside. So at this point of time, it's very difficult. What I feel is what is necessary, we have to do it. What is not necessary, that means if you can stay in your place without traveling, you do it. But if you can't do it, then you take a proper precautions. I would still suggest that maybe in the month of June would be a better time. You take precautions like what I mentioned. Be mindful of what your body is doing. When you're sitting in a plane, be mindful what you're touching and what you're not touching. Be mindful about masks. Be mindful of everything, and you will probably be safe. But I would not recommend attending any big functions or any in this month. At least in June, we probably take a call. Outstation stay post lockdown. That exactly, I've given you that thing. If you purchase something from market, rice and how to sanitize it. So this is one of the major challenges about sanitizing. Like I said, cooking kills most of your bacteria. And many things they say that you can wash it with water, dry it. Sunlight is one of the most important protectant. And we are fortunate that this is summer. So I think any part of India you go have sunlight. Sunlight, washing things which you can wash, what you can't wash, I think when you cook it, it's gone. So cooked food is probably a protectant. Question is, after lockdown, how many months will take care of a child for outdoor activities? I think at this point of time, let's go step by step. Be very cautious, at least in May. And depending on how the situation improves, then you probably slowly start going out with your children. But if you are going out, even in May or in June, do not allow them to do unsupervised. This is what I request. I know it is tough. I'm father. I have children. It's very tough to leave unsupervised, and it's very tough to be always supervised because you need somebody to take care. But this is the only way. We are trying to protect them. There's no other way. And do you think that all surgeries will be? I mean, we as doctors are taking a lot of protection on how we want to go ahead with surgeries. Uh, I want to tell you the lockdown is more in your mind. We have to come out of it. We have to face it. Like I said, if we don't find vaccine, the only other cure is to get infected. I mean, it's not by choice, but we will have to get it infected on, like I said, mildly, and it may just pass. Vaccine comes is a different thing. So, what is most important thing is what process are you following? And all eye surgeons all over the country, I'm sure they're taking a lot of process. We have been discussing on a virtually every day, and it's a matter of time. Most of the things will be safe, and we all will have a protocol to do it. So hopefully, the month of May slowly, and by June, July, August, we should be more clear. Um, what percentage of COVID can be transmitted in the eyes? It's very difficult, very difficult question to answer. I feel very limited, and this is what I know. But reports every day, publication keeps changing. But at this point of time, it's not proven very classically it can be transmitted. How do you avoid depression during this time? Like I said, keep yourself engaged. An idle mind is a devil's workshop. If you're keeping it idle, you are creating the devil to reside. And try to avoid unwanted WhatsApp conversation, Facebook, newspapers. What has to happen has to happen. For a lot of people, what I suggest is there is a lot of online courses today. There's so many online courses which are free. If you have a computer at home, you can take up anything. You can take up art, dance, music, computers, whatever you want. Use this as the best of your best. Use this time, like I said, to create something different. If your mind is active, away from unwanted stuff, there's no depression. Depression only comes if your mind is free and you're only concentrating on that. Do yoga, exercises, keep your body fit. That should take care of it. What precaution should we take when we child to school? If you want to ask me this question, the most important precaution is educate your child. Go back and ask your child how many of your children actually know what is happening. We assume that they know, they don't know. How many of them ask them, how many of them know what social distancing is? If you don't know, the most important thing is both you as a parent, who's a first teacher, and the school, which is your second teachers. The responsibility is to massively, before you teach mathematics, English, and all the other things which so many courses are happening, let us put an effort to teach your child. If your child knows what is happening, the child, if you drill the child into the DNA, the child is more careful than you and me. How many hours do we need to clean the mask? See, if you're using a mask, if you're using going outdoors, if you're using a cloth mask, like I said, if you're not a healthcare professional, please do not use what is used for the healthcare. There's a tremendous scarcity of it. it's going to be a disaster. So you can clean your mask every day, soap and water. So what we recommend is every day if you go out, if you are an outdoor person, you have to work outdoors after May, you keep a soap water and a bucket outside. So when you come home, you put your shoe into that, and so that everything gets cleaned with some Lysol or something there. And also your dress, you take out your dress, drop it into that bucket, one more bucket which has water, soap, and Lysol, and then you take a hot bath. This is what is recommended if you're going out and you're spending time and you have no control on the environment or people you meet. So every time before you meet your family members or come on, make sure that each one of you can have your own methods to do it. So I would recommend that you clean it every day, wash. You can have 3, 4 masks, cloth masks. Uh, Exercises. Try to avoid computers as much as possible. Have a screen time lock where you don't work more than 30 to 40 minutes as a stretch. Give breaks. Every time you have a stress, look out of window, find a place or tree or house or a person who's outside 20 meters outside, so that when you look out, your eyes relax. That's all you need to do. Coronas do not infect your pets, but you have to take care that they could spread it. So that's what I said. Every time you take your dog or cat or any animal for outside, make sure that you wash them with soap water, the paws and other things, so that they're clean. How to take care of newborn infants? I think as much as possible, keep a separate room, distance people, see that not many too many people keep coming and meeting the child, the major, and keep all your functions out. The naming ceremony, first ceremony, that ceremony, everything has to be out. The child's life is more important, so keep as minimal number of people to be in touch with the child or baby as much as possible, and do not allow the world to come and see mother, maybe one more person, that's it, and lock everything up. And that's what is most important. While we are teaching, what precautions we need to take when we touch the chalk, duster, children books for correction, as much as possible, like I said, your as a teachers, you have a certain set of things which you have to do. That is pre-COVID. It's like AD and BC. So what now is after Corona? It's like AC. After Corona, you have to change the way you have to deal. For example, if you are a habit of collecting books as a teacher from all the children, please do not use more of electronic media, paperless systems. Tell them to submit online. Even if they take a screenshot of their answers and send it to you on WhatsApp, make sure that you do it. Keep physical contact as minimal as possible. Like I said, in India, we have a lot of physical contact. We shake hands, we hug each other, we do this, we do that. We are always population. Keep it out. At least for the next 3 or 4 months, till we figure out where we are, keep it out. That's what I would say. Is there any chance COVID can enter our body ear? And see, COVID can enter wherever the mucosal surface is. Mucosa is nose, tongue, throat. So wherever it finds entry, where the mucosal can enter, it can replicate, and it can probably. It's just like your flu virus. It's just a little more posher version of your flu, which we've been getting from the day we were born. So it's nothing fancy about it. So only thing is, it is more potent, more smarter, and it can create a lot of. We know what it's done to our body and what is done to our society. If a patient is discharged from COVID and discharged from over, what's the opinion to avoid not to see? You don't have to. We have to always have a lot of empathy towards people who have had COVID. So let's not try to be in the state where we try to block them off from the society. They're not patients. There's no disease in the body which needs to be blocked. You know, like I said, if somebody is discharged from it, it's over. You don't need to go meet him, hug him, or say, I mean, thank him for coming out of it. All that phase is different. But you don't need to avoid the society or avoid that home. It's not going to come. You need, if we have to, if somebody is a COVID positive person, and if he has to transmit it, there's a guidelines given by the government uh, of European government. You need to be in only around 3 meters distance. That's why you meet the social distancing. You need to have at least 6 meters out. When you meet that person and you spend more than 15 minutes so close that he can transmit. So just seeing from your window somebody sitting in, 2 blocks out doesn't make you that even if he's a COVID patient, he's not going to spread it. So we have to be practical also here. So let's be very clear on this. Uh, can the virus travel 13 feet? See, it depends on, it can only travel long distance when you sneeze, depending on how much you sneeze. That's why you need to cover yourself with your cloth. If somebody sneezes, then it can go to 6, or depends on how ferocious the sneeze is. But otherwise, if you are wearing it and if the person is wearing it, then it doesn't matter. If one gets infected by COVID, with the person immune or a chance of she'll get infected again? Uh, if you get infected by COVID, your body produces certain immune cells which can protect you. See, one of the treatments used in the world is, in fact, we need people who get better with COVID. You know why? One of the treatment used in patients who are extremely sick, even in India they have done it. They take the blood of the person who got better. Every person who gets better is actually a reservoir for future. So all of us can be saved by that person who got better. So let's pray and support somebody who's getting better. And you can take that plasma, the blood, part of the blood, and if you inject it into a person who's really sick, he's got better. So they are a real warriors, ones who are better. So I really, really need that we respect them. You can only in Korea, they have said that the few of them who got positive again became positive, but I'm still doubtful that it may be a probably to do with the testing reports. I don't think at this point of time I can comment whether it was thing. But once you get this disease, you get protected. So there is a chance that it may not come back. I've As a teacher, we travel to school bus on a daily basis. We can take 3 to 4 children. Advisable to if children are traveling to school, like I said, it's the onus on the parents now, at least for the nest. That's a reason we are requesting the schools to keep at least till August closed. If you're keeping it open, the school bus are very difficult. If the school bus can take 30 people, because of the social distancing, you can only take seven kids in the school bus. It's impossible. Half of them go in auto with 10, 12 kids. It's impossible. So only way the school is, the managements have to take a call to push it till August. And by the time we hope that the vaccine or something else comes and we are better, the schools have to decide on this. If touches the affected surface from the hand, and you also wash with the touching the face, so try avoiding doing anything after you touch something, avoiding the face, cleaning your eyes. So one of the things we advise as eye surgeons is stop wearing contact lenses for next 6 months. Keep the glasses. If you don't want to wear glasses or contact, there are other methods with means which can correct, but try to avoid as much as contact touching your face, nose, tongue, anything which is mucosal surface. Virus thrives on it. It's just waiting for a chance to get any of the mucosal surface. Mucosa is your tongue, your anything which is red out here. If someone needs immediate eye treatment, how to go about it? See, most of the hospitals, see, for example, even eye hospitals like which takes care of emergencies have extremely stringent, strong policies to take care of you. See, we are not only taking care of you, we are also protecting ourselves and our family. So we are also very careful that we take care of everything. So we are also protecting. So what protection we give you, we also protecting ourselves. So at this point of time, if you have emergency, then you can call up one of the hospitals and you can walk in, and I'm sure you can, any good hospital organization will have everything by the book given by all the big societies of how to take care of it, so you can be safe there. But of course, like, something happens, you get something, you and me, both of us can get it, so we don't know about it. But at this point of time, I can assure you that most of them are very safe. Do we avoid air conditioned room at this point of time? Central air condition, uh, I would ask you to avoid it. Anything which is central air conditioned, probably for a few months, avoid it, and that makes a lot of sense. Can COVID transfer by files of mosquitoes? Mosquitoes, no. Flies, no. At this, again, that's the debate. So people uh, make a lot of thought uh, on flies. Recently, there was a talk about it, but these are all many times. We really don't know how much it's true. So I don't want to give you anything which is still not scientifically fully proven. So I still say that at this point of time, transmission is more from human to human at this point of time. My job is to travel a lot, avoid a travel. Like I said, if everything depends on travel, your job, life, then you have to. But if you feel that you can cut down a lot, you try to cut down as much as possible. See, if you're a traveler, we all travel in plane, and all business travelers have the suit, your coat, your tie, and reduce everything. This is where it spreads. And always, if you're traveling, you have to travel. People are traveling even now. Be mindful about what you're doing. I think many times we don't even care. What are we touching? We don't care. We're holding the railings of anything we get. So now let's be very careful and mindful that what you're doing. Apart from wearing cloth masks, going out, sunglasses, it whatever it is, it gets protection. If you want to protect, there's one with bigger glasses. We call it the people one you use for the swimming, but you don't need to. As long as you wear a protection glasses, it's okay. But if you're going to a place which is high risk, then wear one of those swimming kind of a glasses. But it's not very comfortable. I think we are finished with all the questions. Be safe, be mindful, and be aware of how you're going to take care of you and your family. God bless. Thank you.